and in a lot of places was confronted by small children doing cartwheels in the streets for money, and people dying because they didn't have access to medicines. And I came back and started studying it further. And one of, I think, the biggest travesties of our time now is that 10 million people around the world die every year because they don't have access to existing drugs and vaccines, I'm sure you know. But at the same time, the U.S. government has spent, in 2006, spent $340 billion on research and development. And that's a lot of the new innovation that comes out. It happens because of this money, but then it's licensed out to companies who have exclusive access to it, often for 20 years. And even in places where generic companies could produce drugs for people who would otherwise just die because they couldn't afford it, they're not allowed to because of restrictions on intellectual property. So I was wondering, when you become president, will you ensure that the money that goes to federally funded institutions and universities has licensing provisions put on it that allow people to have access in places where they simply can't afford it at the exclusive cost that companies are charging?
Yes, and again, I asked Dr. Coburn to weigh in on this, but is there anybody here tonight who's from this organization called One O&E? Well, there's a new organization that has sprung up around America. It now has 2 million young volunteers. It's called One O&E. Bono is one of the motivators behind it. And these millions of young Americans are dedicated to the proposition you're talking about: malaria, HIV/AIDS, the fundamentals that could save millions of lives. And they go to Africa and they go to these countries. So if you hear of this organization or you meet someone, I think it's really the best in America. Look, I will ask Dr. Coburn to talk about the drugs and when you get them to market. But I would remind you that those places that you visited, where the kids are turning cartwheels in the streets for money and a lot of other terrible things for money, it has to do with bad governments. It really does. Some of the richest countries in the world that have oil money and lots of other things, Nigeria springs to mind, and they have corrupt governments, and the government doesn't get, and the money doesn't get to the people. And many times, I'm sorry to tell you, your tax dollars that goes to these countries to try to help them ends up in Swiss bank accounts. And so I'm all for helping them, but I've got to have a proven record that these countries will actually have that money go to the people that need it, and that they have policies and practices in their governments so that we can actually get to help these people. So I want to make sure that I'm willing to send your tax dollars to help children get well and stay well in these countries. But I'm not willing to do it unless I have absolute assurance that those tax dollars of yours are well spent. On the drugs issue, you mentioned.
Sure. Well, a couple of things. We have programs called USAID, and unfortunately, they're not very good. And I want to give you an example of one. It'll take me just a minute to describe this. When I went to the U.S. Senate, we were spending $107 million a year in Africa on a malaria program through USAID. Now, 500,000 babies, children, a year die in Africa. Another 500,000 pregnant women die in Africa just from malaria. Of the $107 million we were spending, less than $7 million was actually given into drugs, bed nets, or residual spraying. And why was that? Because nobody in Congress was looking. Now, I'm pleased to tell you we're going to spend $110 million this year, and $102 million in medicines, bed nets, and spraying. So we're going to make a big dent in that. So there's a couple of answers to your question. One is, why does it take $500 million to develop a new drug in this country? Because of the bureaucracy that we put in front of it in terms of the FDA. Why is it you as a citizen who has a terminal disease can't have any medicine you want, whether it's under trial or not? Why can't you have that? It's the fact that we're not doing our job in Congress to oversight the bureaucracy. Intellectual property matters, and we have to protect intellectual properties. But when you're paying for it, then there ought to be that funding go streamlined back in to help third world countries, as we would want to do. So the profits off the licensing ought to be spent back making the difference that you'd like to make with your life in third world countries.
By the way, if you had an additional comment, I'd be glad to hear it. Please go ahead.
I guess on the corruption comment, I know the World Bank recently came out with a report that found that only about 2 governments in Africa are still considered corrupt, and that the U.S. government shouldn't give money to countries that would spend it corruptly, but that does not need to happen if it's done in an effective way, and there are great mechanisms for doing so that we can employ. Also, the issue I was bringing... Transparency, yes. Go ahead. And with intellectual property, the issue I was trying to raise is that the U.S. government is funding research, and then companies have exclusive access to the products of that research for 20 years. Whereas there are companies that could produce the actual drugs at cost. It doesn't require sending aid. It allows them to produce it in what would be considered a free market with generic competition. And I believe you're a proponent of the fact that a free market raises all boats.
Well, I'll let Tom answer this, but maybe there's some tax dollars that goes into it, but it is now the drug companies that spend most of the money to develop these new drugs. They've got to have the right to have a profit from it. Now, you're probably talking to one of the great enemies of the pharmaceutical companies in Washington, so it's hard for me to defend them. I don't know how you can justify not being able to re-import drugs from Canada, in my view. But I don't see how you can justify not having drug companies compete for Medicare patients who need prescription drugs. But on that issue, I mean, if they're going to spend billions of dollars with U.S. help to develop a drug, and I think 98 or 99% of the new pharmaceuticals and drugs are invented in the United States of America, then they've got to have some protection before they have it handed over to another manufacturer. And I don't want to drag up the conversation, but
I just say transparency is number one. If in fact your tax dollars are paying for all the research, you're right. But that isn't true. And there is a combination of things. Remember, the universities here that get federal funds and develop something, they get benefit from licensing, which improves their capability to do further research, but also lowers the cost of attending your university when they make a breakthrough. So it's not, I wish it was as simple as what you say it is, because if it is, we could do exactly what you want. But if you don't protect personal property rights in this country, whether it's intellectual or land, you undermine our ability to have a functioning system that will raise all those. So I think your first statement was right. You're idealistic. I want you to be there. Lead us to where we get better than where we are. Your real question is why can't we let people who can produce this from a generic factory in India have what is intellectual property in America? And if you do that, then who's going to put the money in to develop it in the first place? And it's not all government money. It's only about 15% government money in terms of total research spent on pharmaceuticals in this nation.
Now you see why I brought